about us. Think about...
Are we live? We are live. What's going on? How is everybody? Hope everybody is well. I think we are live on Instagram, Facebook, LinkedIn, all the different places, YouTube. What's going on? I see Roel's in here. Let's see where we at. Debbie, I hope you feel better. Thank you, Roel, for the positivity. How's everybody doing today? We're going to let a few people come in. Tom, what's up, my man? I did. I lifted a little bit today, and honestly, I kind of just barreled through it. You know, have you ever been in the gym and you're just like, man, you know, let's just get through this set. That was today. Foxy Moxie, what's up? Great to see everybody. If you're with me, let me know. I see you guys on Instagram. Thank you all for hanging out. Oliver, I see you. All them gains. I didn't get any gains today, I feel like. Maybe, maybe just the the satisfaction that I got it done. Grandma Mary, I love you. I'll see you soon. Why is that? Jerry, what's going on? Lisa, thank you for sharing as always. So good to see everybody. Hope all of you are well. Michelle, I see you from Oak Ridge. I love you. Let's see. Doc is getting ready to roll. Mike is good. All right, cool. Cool. We're getting ready real quick. I'm going to put this up. If you guys did not check this out, this was the Common Sense MD episode today, diagnosis and treatment of ADHD. Super important episode. We believe ADHD is super underdiagnosed. So make sure you watch that most recent episode of Common Sense MD. It's a solo episode with Dr. Rogers. And then this one with the star of the show, Robin Riddle, on Explains NAD+. We've gotten a ton of questions on this very show about NAD and NAD+. Robin explains it all in this episode. So make sure you check that out. We're going to try to get as many people to watch this episode as possible because we know how important of a topic that is. It's kind of a hot topic right now. Let me know in the comments if you guys have watched either one of those videos. Let me know what you thought. Ivy and JC with Ivy, what's going on? Sandy, how are you? Edna, hello. Jack, what's up? Dennis, what's up? Let's see. Doc is ready to roll. What's up?
Hey, Ben. How are you?
I am wonderful. Having a fun time in here with the community. We're hanging out like we always do on Tuesdays.
Good, because your beard's getting long. Your beard's getting thicker.
I need to clean this up. I know I do. Now I'm looking at it. I mean, I cleaned up the edges there. I just gotta trim up a bit.
You got married. You just don't care anymore, do you?
I love it. How was your day?
Great day. Had a great day at the office. Busy, but very enjoyable. Saw some great patients. A lot of new stuff, of course. Just a great day.
Tom said I look like I just came out of a mental institution.
He's always got some great ones.
I see Tabitha.
He's got to be a stand-up comedian. Tom's got to turn into a stand-up comedian. He's really good.
I love it. I love you, Tom. Tabitha, I love you. Thank you for being in here tonight, as always. Stan, what's up? All right, Doc, you ready to rock and roll? We're going to get to every single question tonight. If you got a question for Doc, go ahead and put it in the comments. I see you, Eunice. Great question there around ADHD. If you have ADHD questions or NAD+ questions, tonight's a good night to do it. All right, let's start with we had one come in throughout the week. This is around kind of Fenben, ivermectin. The question is, my husband had glioblastoma removed as preventative, and to get any remaining cells, we have been doing the Fenben protocol with all the supplements Dr. Rogers recommended. We do the regimen 6 days a week because being that cancer is so aggressive, been reading a lot about ivermectin for cancer. Do you think we should add that into the mix also? So we'll start there, and there's a follow-up question.
Yeah, I do. We've started using them on using ivermectin as well as Fenben on most of our patients with cancer. When you have a cancer, especially one that like a glio or another cancer that has metastasized, hopefully glio hasn't, but it's a serious cancer, as you know. Yeah, you got to get pretty aggressive with it. I certainly think both Fenben and ivermectin have their own parts. They're both anti-parasitic drugs, but they work in a little different ways for cancer. Fenben's usually the first one we use, and it works really in a lot of ways, but really it kind of disrupts the microtubule system and inhibits glucose transport into the cancer cells. As you know, cancer cells depend on glucose. Their metabolism is different than regular cells. So this kind of disrupts that microtubule system. And also, it really just changes the metabolism, causes apoptosis of cancer cells. Also, has something to do with enhancing I think it may be enhancing, or what you call it, translocating the P53 gene, which is a gene that everybody has that is a cancer suppressor. When you don't have enough of that gets weak through any one of many reasons, whether it be genetic or your own metabolism through the years and damage that you've had, oxidative damage, then that P53 doesn't work very well. And so when you quit putting out those suppressor cells for cancer, cancer can grow. So what ivermectin and fenbendazole do is help that P53 gene kind of translocate to the mitochondria of your cell, where all your energies produced. So it kind of disrupts cancer cell metabolism. Cancer is just atypical, abnormal cellular growth. And what you're trying to do is arrest that growth and kill it off. So those two drugs are cytotoxic. I think they work in tandem. There's a lot of other stuff you need to do as well. So I'm really, really getting aggressive with using both of them, along with other things. I just bought a book. I didn't buy the book. Actually, a patient gave me this one, The War on Ivermectin.
Really?
It's a really good book. It's written by Dr. Pierre Corey, and he was one of the frontline doctors for COVID, and really interesting book. Fascinating book. So ivermectin is a multi-purpose drug that we use for a lot of things. Very useful. There's so many studies that say it works. The studies that say it doesn't work, or have been heavily biased, let's put it that way, and suppressed. But there's no doubt in my mind from practical experience that it does work. It's very safe. Very safe. So yeah, I'm all for it. So yes, you should use both.
Let me see here. I'm going to put up there's a follow-up there. Then I see there's a couple comments. Thank you guys. Has anybody read The War on Ivermectin in the comments? If you have, let us know what you think. Also was wondering if you think red light would be helpful.
Yeah.
Thank you for what you have done to spread awareness for Fenben.
I do. It's great for your mitochondria. It's healing. Mitochondria, just like I talked about the P53 suppressor cancer gene, is involved in mitochondrial activity, and it's going to enhance your mitochondria, make it work better, thereby making more suppressor cells out there. But red light's just a great therapy for multiple things. Uh, love red light. I do it every day. I'm not going to put my mask on tonight like I did one time. It's kind of funny.
I love it. It's such a great question. I appreciate that coming in through email, and I'll put that. I see Lotto's got a comment here around the fenbin. So studies using mice to study cancer. 2 types of mice could be used. One type fenbendazole doesn't work. Determine the mouse model before passing judgment. It's a great comment, and I appreciate
Yeah.
this, Lotto.
Yeah. There's just there's not enough human studies. They are studying it though.
Yeah.
At all the big
Yep.
centers, they're doing trials with fenbendazole.
Yeah.
And from everything I've read, they're positive. But sometimes you don't have time to wait for a double-blind study on a parasitic drug. There's just no money in it for them at this point. Some people have speculated that the reason the FDA doesn't like it is because they want a drug company to come out with the drug so they can make a lot of money off of it. But right now, you get it over the counter. It's cheap, so
Yeah.
it's for animal use. Mebendazole is the one that is approved for human use, not for cancer, but it works as well. It's just really expensive. So, sometimes you got to kind of, when you're facing cancer, you have to pull all the stops out and do anything you can. If there's evidence that it may help and it won't hurt you, why wouldn't you?
Yeah.
So,
Yep.
um,
Great comment there, Lotto. Thank you so much. Katie, I see you. Carter, I see you. Mariah, happy Tuesday, Carter. Happy Tuesday to you. Mariah, I see your question. Thank you so much. Let's see. Motaz is in the building. Motaz, what's going on? Rebecca, Terry, man, we got a great crowd tonight. Thank you guys for hanging out with us this Tuesday and talking about health and wellness with us. If you have a question for Doc, go ahead and put it in the comments. We're going to get to everyone. I'm going to put this up from Katie. It's so funny. Katie, Carter, my brother Andy, Ben Curtis, they're working so hard on the project right now. I want to say how proud I am of them.
well, they are.
Yeah.
How many charts we have left to transfer?
They're just doing amazing, and we can't thank you guys enough for all the hard work you're doing. So I don't think Andy's watching right now, but I know Carter and Katie are here. If y'all are just doing amazing, thank you so much. Gailey, I see you. I'm gonna put this up. Thank you so much. You watched the G6PD video. Thank you for hanging out tonight. We answer health and wellness questions on this show every Tuesday night. Any new people here? Any other new people in the community? Teresa, I see your type 1 question. Thank you so much. About 200 left. I love it. That's amazing.
200 left? Is that all?
Yeah. Shout out to the Kingsport office. That's amazing. Okay, let's real quick, let's put this up for Debbie. I want everybody to be thinking about Debbie. Hope you recover from the flu. And doing that while managing diabetes is not easy. So we're thinking about you, Debbie. Thank you for being here, as always, from Australia. Okay, let's start with Oliver on YouTube. If you have a question for Doc, put in the comments. What helps with better vision? I have double vision, especially when tired / groggy. Important question. Have you seen double vision quite a bit in office? What's your thoughts on this?
I don't see double vision a whole lot. I've had it, but yeah, you wonder if first of all, see an ophthalmologist and get or an optometrist and get a good eye check to make sure you don't have glaucoma or some other visual retinal problem. They're going to be able to tell you more than I can. But when you're tired and groggy, it makes me wonder if you're getting hypoglycemic, especially if you're getting brain fog with it. So it may be metabolism. That optic nerve is pretty sensitive and huge, and things can affect it, like bad food and smog and toxic things in your food, like various food dyes and things like that. Certainly mold can affect it. So, yeah, you need to see a good eye doctor. And, when you're tired, if you're tired, look at your, always look at your sleep patterns, look at and wear a Stello to see if you're getting hypoglycemic when that happens. See what you've eaten that might have affected it. Um, get a sleep study if you think you suffer from sleep apnea. You might even try something like methylene blue. We use that a lot for that
Yeah.
that time of thing. If you get tired and groggy after eating a meal, you're probably getting hypoglycemic or maybe even hyperglycemic. Either one can make you feel that way.
It's from Debbie. Get blurry vision with
Yeah,
hyperglycemia.
sure. Yeah.
Yeah.
You may be really insulin resistant and be having some sugar problems. Wear a Stello.
Yeah.
I had mine on 2 weeks ago. I'm not a diabetic, but I wear them a lot just to see what different foods do to my sugars and what it's doing at night. If I feel bad and I look down, I can tell when I'm hypoglycemic.
Are
And
you planning on kind of routinely using a Stello like once a quarter, twice a year?
just every once in a while,
Okay.
a few
Just to
times a
see.
year.
Have you
Yeah.
found that it changes in terms of like, do the same types of food spike your blood sugar or
Usually it's pretty consistent. I can
Yeah.
tell by using one for several times, I can kind of tell what sugars bump it up and what doesn't. And if I take a walk right after a meal, it blunts it down.
I'm seeing some comments around DMSO for vision as well. That's interesting. I see DMSO eye drops. We got to do a podcast on DMSO.
DMSO is a great little product. It's
Yeah.
just amazing. It's a good anti-cancer
Yeah.
product as well. But yeah, if you ever get a chance, you should listen to this guy that calls himself the Midwestern Doctor. Just
Yeah.
Google him. Google him and his talks about DMSO.
Say that name for everybody one more time.
He's got a blog called A Midwestern Doctor.
A Midwestern Doctor. I've heard you talk about him.
Yeah, he's a sharp guy. He practices medicine in the Midwest. He doesn't want anybody to know who he is because I guess he doesn't want to get censored, or who knows. But he's opinionated about a lot of things, and he's right on track. I think he's exactly right.
That's cool.
I agree with most everything he says, but he's really expert on DMSO.
Interesting.
It's been around forever. I've been around forever. We usually think of it as a cream that brings other things into your joints. It's a cream or solution that really allows you to put it on and bring other medicines in. Like you put that on your knee and put some ketoprofen in there or even some steroid cream, and it goes right in your joint. I've done it. I've used it. It works great. It's healing. It's anti-cancer. It's good for your spinal cord if you have spinal cord injury. Read the Midwestern Doctor's take on DMSO. I'm going to come out with a podcast. I'm kind of just working on the doses I'm going to use it for adjunctive therapies for cancer. But, it's a lot of work to get that together.
Thank you for those comments, guys. I see Smoky Mac. I see you, Michelle. What's up? We're gonna get to questions here. Thank you guys for the questions in the comments. All right, let's keep moving here, guys. Let's see, where am I at? Okay. There we go, Eunice. Let's get to Eunice's question on YouTube. Hi, what percentage of ADHD are adults over 60, and can they take meds without issues / side effects? This is in regards to the, I'm assuming, Eunice, the video that we put out today. What's your thoughts on this for Eunice?
I don't know what percentage of ADHD are adults over 60, but what I can tell you is that once you have a ADHD, you always have it. There's varying degrees of it. So if you had it as a kid, you still have it as an adult. So I forget what stat I put in there today on how many people have it, but
I want to say it was like 4%, 4% of adults, 11% of kids, something
Yeah,
like that, and
that are known,
they're
been
known.
diagnosed with it, which is
Yep,
vastly underreported for sure. And again, your symptoms may not trouble you that much until you get overwhelmed with things. But
yep.
certainly, I treat people over 60 with it a lot. Um, and adults, I certainly use low doses. I start low, go slow. But yeah, it definitely works. Um, definitely treatable. I don't use any medicine unless it's really needed. But some people discover later in life that they've had it all their lives, and they're over 60 and they start taking low dose Adderall or you know some other things, even if it's a like L-tyrosine or one of the
Yeah.
over the counter things, they can improve. But yeah, certainly it's treatable.
A couple just for those
I'd
who
say
haven't.
10%. I would say roughly 10% of the
It's
patients I see, if you really dig into it. Now, not all of them need treatment, but that's just a guesstimate on my part. But
definitely check out that episode, guys, if you have not. He mentioned L-tyrosine, the omega threes, and a few others. Did you put methylene blue in there?
yeah,
Methylene blue as well. Thank you, Eunice, for teeing us up on that. Let's get to Dennis here. Dennis, thank you for being here as always. What do you think about Fatty 15 supplement?
I
What's your
take
thought?
it. I take it. I like it. I've been taking it for about a year. It's another type of omega, is what it is, and of course, I think omega threes are probably the number two supplement that I always recommend for people, right behind D with K. But I've certainly been taking it for about a year, and if you read all the studies and information about it, it's just a great aging supplement. Helps anything from your brain to your heart to your joints. And again, I still take my omega three, but I put that on top of it. I'm interested to see what it does to my fatty acid analysis on my Cleveland panel. I'm going to check that very soon and see. But I like it, Dennis.
Mm.
I think it's a real deal. I really do. Not many people know about it.
Dennis, thank you for that question. And a lot of times, you'll kind of learn what Doc thinks about it just by saying, "I take it myself."
I've been waiting to do a podcast on Fatty 15. I just want to. I always try something on myself before I pass judgment on it, uh, and I like to see what the numbers show too with my
Yeah.
fatty acid analysis. But
Dennis, thank you so much, man. Let's get to Linda here on Facebook. What's the best medicine to take to reduce triglycerides and LDL cholesterol? Similar question as getting into the Cleveland here.
probably if it's a prescription medicine, Gemfibrozil
Hmm.
is it's a prescription medicine. I'll put something on that this week. Of course, the other thing that will help, especially triglycerides, is omega threes and probably fatty 15. But and of course, the best medicine to reduce LDL, or the most potent one, of course, is your statins. But again, I use them sometimes in people with known coronary disease, but I don't use them too much. Like most doctors, they push them pretty hard. Um, there's a new class of drugs out too that even do a better job without the side effects of statins, but they're injections. Um, so you may explore that option as well. The only place you're going to get those are going to be probably a lipid clinic or a cardiology clinic.
Mm.
Uh, but those are the ones I like a lot. The other thing I like is berberine.
Yeah.
Berberine's the best supplement, I think, that you can take that's a non-prescription drug for that.
Linda, great question. Thank you so much for that. Real quick, I see Shield Nutraceuticals is in here. Steve Nice, my brother. Thank you for being here as always. I see TriStar Strength and Rehab is in here over on Instagram. Josh Davis, what's up, my brother?
Hey, Josh.
Thank you so much for being here tonight, man. I want to get to this from Rebecca. And Rebecca, if I'm missing part of this, let me know. So gut health, leaky gut syndrome, IBS, HP. I'm assuming this is around just what we might suggest for this?
Yeah. Yeah. I
What's
mean,
your thoughts on this?
it's a big topic.
Yeah.
When anybody comes in our offices and they're not feeling well, they have an autoimmune disease, or they're not getting anywhere with, their general health. We always ask about the gut first because that's where it all starts. That's where most of your immune system is located. And leaky gut is a term that we use, like IBS, irritable bowel syndrome, that we use when we don't know what to call it. To be honest with you, so they're all interchangeable. It just means idiopathic. We don't know what the heck to call it, but it comes with a certain set of symptoms, and basically it's where those tight junctions in your gut, um,
So
uh,
protocols.
those tight junctions in your gut that keep out all the bad stuff get inflamed by various toxins and different kinds of foods like dairy, glutens, and various people are sensitive to, how they have food allergies. Sugar is a major offender for causing leaky gut. You get that dysbiosis, so your gut microbiome gets out of balance, and you get leaky gut, which means you have the toxins can leak into your bloodstream from your GI tract, setting off an inflammatory cascade. Those people always get sick with the easiest thing. And they usually always have some kind of digestive problems, from whether it be cramping, diarrhea, constipation, bloating, gas, GERD, all that. They can have some of it or all of it. And first of all, you got to look at the diet. The protocol is to figure out what you're eating that's probably causing it. The other thing that can cause it, obviously, is stress. That gut brain axis, vagal nerve that we talk about all the time. So you look at that first. You look at what you're eating, and you need something to promote the good bacteria in your gut and get rid of the bad bacteria. Something like digestion. So we're talking about, probiotics and prebiotics and digestive enzymes. Best overall gut pill I've ever seen, because it covers about everything. But you still need to eliminate those foods that can cause it, or maybe the stress that can cause it, or maybe a medicine that's causing it. So the protocol just depends. The first thing I, of course, look at would be what you eat. I'll eliminate all the toxic foods. Put you on a really stringent autoimmune diet, something like Dr. Gundry promotes. And then, of course, I would add digestion to it. That's just the best there is. And then, if you're still having problems, we always measure inflammatory markers. Sometimes we do stool test, the GI map, which is very telling to see, what pathogenic bacteria you may have in there. If you have yeast, if you have H. pylori, if you have SIBO. So there's a lot of, it gets complex. There's no one size fits all thing when you talk about your gut. And it's really sometimes difficult to sort out. Doctors don't want to do it. You have leaky gut, take some dicyclomine, Bentyl, which, may help cramping a little bit, but it's not going to solve your problem. Like I said, a few weeks ago, when somebody asked me that they were getting their colonoscopy and EGD and wanted to know who to talk to about their diet, I told them, anybody but your GI doctor. That was a classic. That's true. They just don't know, number one. Number two, I don't know if they care. They're too busy running scopes. So there's no incentive for them to sit down and talk with you about your gut, your diet, but they may send you to a nutritionist or something who has the wrong ideas, who's thinking in terms of what we used to tell people 30 years ago. Think about diabetes, the food exchange plan. It's just totally worthless. So you really need a functional medicine doctor that looks at your gut health and, is willing to run some tests, try some things, actually, knows how to diagnose microscopic colitis, for example. But there's a lot of people out there with ulcers, H. pylori, SIBO, ulcerative colitis, Crohn's, celiac, and so many people are sensitive to gluten that test negative for celiac. That's the first thing I'll eliminate is gluten. Besides sugar, gluten's those are three bad boys. And then I also look at I always say corn, soy, raw vegetables are hard to digest for a lot of people. Everybody's
Yeah,
gut's a little different. Then you throw on the stress on top of it, and it's sometimes difficult to deal with. And these people get labeled as nutcases and all. Sad.
I'll say this. Lotto mentioned the carnivore diet, and I'm sure.
Love carnivore
Yeah,
diet.
yeah, the carnivore's a great comment there, Lotto. Thank you for that. And also for Rebecca, we've done explained this episodes on H. pylori, leaky gut, as well as candida, I believe. But if you search for any one of those topics and Robin Riddle or performance medicine on YouTube, there's more detailed videos on each one of those. So thank you so much for that question. I hope that helps Rebecca a little bit. Let me know in the comments if that helps any. Let's get to Jack. Doc, what's your thoughts on L-theanine to help stay calm under pressure and help with sleep? Great question.
L-theanine is a great herbal medication for calming you down. It's not the best sleep for me, at least. It doesn't help me sleep. I've tried them all differently, separately, together. Um, a lot of people use it to cut down on what we call mind chatter. Like at night, if you're just laying there and you're thinking about everything of the day, what you're going to do tomorrow, it really calms that down a lot. So, I do like L-theanine. I have this stress formula that we made with L-theanine in there, saffron and ashwagandha. So I combine them all so you get the best of all of them. But yeah, I mean, those other methods too that you need to do to stay calm under pressure. One of them is learn, how to breathe. Of course, and wearing yourself out physically and exercise is always a great philosophy. I have this vagal nerve stimulator that I have,
Yeah.
Vega, that stimulates your vagal nerve in your neck, and it really calms you down. That's a nice little tool to activate that parasympathetic nervous system, the rest and digest part of your nervous system, so your sympathetic's not in overdrive all the time. But certainly try it. Try L-theanine, 200 milligrams. Good place. But and some people it works good without anything else. Everybody's different.
I want to say one. We've got to get that tool on the show at some point because it is very interesting. You've done it in front of me. I think I might have done it on myself as well. Where it calms the parasympathetic nerve.
Yeah, if she'll
it's
bring
cool.
it down, if Jenny will bring that down, I'll demonstrate it right now.
Hey, yeah, we'll do it right now, Jack.
I can put
Jack,
the red light on. Red light therapy at night's really good too for calming you down.
Thank you for that question, Jack. Yeah, okay. Jack says he's doing red light. Thank you for that.
Oh, good, good.
All right, let's get to Foxy Moxie while we wait on the tool. Anything good to take for vertigo? I take meclizine, and that helps. What's your thoughts, Doc?
Yeah, that's the prescription medicine that we've used for decades on it. It's an antihistamine that kind of calms your inner ear down. Vertigo can get pretty serious. I talked to a guy the other day. He had vertigo, which wasn't benign positional vertigo. The Epling maneuvers didn't work. So if you have benign positional vertigo, meaning that when you turn suddenly, you get dizzy, that's due to these crystals, these salt crystals in your inner ear that fall off into the fluid, and those semicircular canals that are responsible for your balance, and they get in there, and you can kind of drain them out by putting yourself in different positions. Ernie Dixon does those in the office quite often, and they're pretty. And he can teach you how to do them on yourself. It becomes recurrent, but as you age, these salt crystals can kind of fall off, and that fluid and really make you dizzy. But meclizine is probably the best one. The other one I use when meclizine doesn't work, and it's really severe, is Valium. To sedate the inner ear. You don't do that for long, but certainly short term, it works pretty well. I had one day when I was just horribly dizzy. It was one of the worst feelings I've ever had. Walked out to get my newspaper in the driveway years ago, and I was walking sideways. What,
Mm,
then I got back and I thought, am I having a stroke or what? And immediately started vomiting as well. And for the whole day, I was just had to lie motionless.
mm,
I actually called my brother, who's a doctor, to come over and said, make sure I'm not having a stroke. And I wasn't, of course, but the meclizine certainly helped me.
mm.
I think it was a viral labyrinthitis is what they call it. So, yeah, but if it's associated with hearing loss and ringing in the ears, then you may have something called Meniere's disease. Sometimes for that, we use diuretics that seem to help.
Mm.
They're working on that endolymphatic fluid in your inner ear. So,
Thank you, Foxy Moxie. I hope that helps a little bit. Perfect.
yeah, you
Perfect.
may have a little Meniere's. Yeah.
Okay. Thank you, Foxy Moxie, for that. Let's get to Teresa on Facebook. Can a type 1 diabetic take ivermectin?
Sure. Both my type 1 diabetic kids do.
Yep.
Certainly.
Thank you, Teresa, for that. Let's get to Jessica. Love these questions, Jessica, by the way. What emergency prescription medications do you recommend for a safari in Tanzania? Tanzania.
Tanzania. I've heard of Tanzania.
Tanzania.
Yeah.
I'm showing my East Tennessee. Tanzania.
Hey, you're gonna have a good time. You're gonna have a great time. That's gonna be fun.
I have all the vaccines from my last trip, but what prescription and non-prescription do you recommend? Thank you, Jessica.
Yeah, definitely. The non-prescription takes some ivermectin. In Tennessee, of course, we can get it, over the counter at certain pharmacies. But I think you should always take ivermectin. With a trip, with travel, with especially when you're on planes, you're on maybe boats and all that. I'd take it twice a week, just prophylactically. Certain prescription, you may have to take an anti-malarial medication as well, like Malarone or something. It depends on what part you're going to as to which one they recommend, but I think Malarone's the most common. It's a prescription medicine. But I'll also take some Zithromax. I would take some doxycycline. These are antibiotics. And for real emergencies, I'll take some Cipro, which is something I don't use much. But for emergencies like a traveler's diarrhea, it works pretty quickly. I'd certainly take some Zofran for nausea and vomiting. I'll take Imodium if you get diarrhea. Always take melatonin on those trips for, the jet lag and things like that. Always take some ibuprofen if you need it. I would take a steroid dose pack, a little prednisone, which short course, which could help in many different situations. But I definitely have a little medical kit. And take some Bactroban ointment prescription, which is for infections. So, yeah, I try to get my patients all up to date on their
The only thing
medicines.
I didn't hear you say that I've heard before is charcoal. Would you add that?
Yeah, activated charcoal. Yeah, especially if you're going somewhere like Mexico or somewhere where you may, get food poisoning. So that's always a good idea. Great.
Jessica, I hope that helps. Thank you for that awesome question. Tanzania. Okay. I've got my pronunciation.
I've got my globe right over there. I'm gonna see where that is.
Yeah, we need to see where Jessica's heading. Thank you for that. Safe travels. Edith is asking, what suggested dose of ivermectin would you add with Fenbin being used for brain cancer?
If you're say 70 kilogram, 165 pounds or so, then I'd start out at 30 milligram, and I would take it twice a week, and I'd take the Fenbin 6 days a week. Depending on how you're doing, I'd move it up on both those doses. I'm using higher doses than I used to use. Now, remember, when you use these medicines, even though they're safe, you should still get, every couple months, you should get a blood test called a CMP, complete metabolic panel, to look at your liver and kidney function. It's just good form to do that. And also maybe look into some IV vitamin C. I would definitely be on all those. I'd be on turmeric, curcumin, milk thistle, uh, CBD.
Mm.
There'll be several things that we use in our protocols. So
Edith, I hope that helps. It's a great question. Thank you for that. Lisa, I see you. Thank you for being here. Cece, I see you. So good to see you as always. Okay, let's keep moving here. Thank you, guys. Jerry's got a great question. Serapeptase has made my large keloid crust. Scared of catching it as it might bleed. If I soften it, it leaks. So I was wondering, does it eventually fall off or any more, or is there anything else I can do, essentially?
Yeah, I love serapeptase. It's great for scars, for a lot of
Yeah.
people that have had to have multiple injections, like my diabetic kids. It just seems to soften things up. It's also kind of a good natural antiplatelet, drug thinning natural medicine. We used it a lot in COVID. But yeah, I mean, I don't know what you mean by scared of catching it as it might bleed. I guess scratching it's probably what you're saying, scratching, not catching. Yeah, try not to scratch it for sure.
And one thing I'll add, Jerry, is there's a dive into diet episode on serapeptase, and Robin Riddle just didn't explain this one on serapeptase. We recorded it last week, so that should be up in the next couple weeks. And they talk a lot about the scarring use for serapeptase, helping with scars or scarring and scar tissue. So thank you for that question, and I hope that helps a little bit. And stay tuned for the episodes on serapeptase. Okay, let's see where we are at. Thank you guys for being patient with me. And if you're new here, let me know. I want to make sure we get to all the new ones. Let's get to Smoky Mac. I think that's where I'm at. Smoky Mac is asking, can you tell me the benefits of methylene blue? Just purchase some.
Oh, good. Yeah, that's something I take every day as well. And you should look at some of the podcasts we've done on methylene blue, because the history of methylene blue is just amazing. Basically, these German chemists back in the late 1860s started looking at it under a microscope, and they noticed that it delineated all the parts of a cell. The next thing they noticed, it delineated the malaria parasite. Next thing they noticed, it killed the malaria. So, it was the first really medicine that killed malaria. Actually, it's a precursor to hydroxychloroquine that we use so much of during COVID. But in any event, that I almost lost my license over. But also saved a lot of lives, so it wouldn't have mattered.
Yes.
To me. But anyway, methylene blue has been used through the last century or more for many different uses in medicine. One, of course, we use it in surgery to kind of see where a tract it goes, where something communicates, like a fistula. They also still use it in pathology to stain slides with. But also, one of the main things you're going to see it used for is in every emergency room. When somebody comes in with a carbon monoxide or a cyanide poisoning, they put it in their vein, and it immediately reverses methemoglobinemia, which means that it puts oxygen back on your hemoglobin molecule, so you can get oxygen and you don't drown in your own, blood, so to speak. But so it's a life-saving medication for that. I think it's a good antiviral. It's natural and antibiotic. It's an antifungal. It's antiparasitic. We use it a lot for cognition.
Yep.
Seems to help people with their cognitive, because I guess it delivers more oxygen to the brain. It prevents UTIs. this is multi-purpose medicine. It helps you breathe better. I like it before I work out. I think I breathe better. We learned to use it during COVID. We learned a lot about repurposing drugs when COVID came along
Mm,
because nobody else was doing anything. So we had to think, and read the research and study some of these things the outsiders were promoting, like the frontline doctors, and um, that's what how ivermectin came to be so popular out of the COVID uh, pandemic.
mm.
So really interesting. So yeah, all those things. Go look at some of the really interesting podcasts on that.
Yeah, Smokey Mac, thank you for that question and letting us talk about methylene blue. It comes up every show that we do. It's such a um, it's something that we believe a lot in. Obviously, if we have two Common Sense MD episodes specifically on methylene blue, if you search for methylene blue, Tom Rogers or performance medicine, it'll show up for you. Smokey Mac, thank you, man. Okay. Gailey's asking around G6PD, and I just want to give some context. It's for her son, who has a severe case. So we're searching for. I would like to know more info on foods to avoid with the G6PD. I feel like doctors around my area only say avoid fava beans and henna. I have made research and feel like they're like they have to teach the doc. It
Of
goes on to say
course.
that they're teaching their son's hematologist. So Gailey, thank you so much for
Yeah.
being here and asking this question.
Yeah, that's a rare disorder, but
Mm,
something we check all the time in people, especially if we're considering giving IV vitamin C in high doses. And some people say you use high doses of methylene blue, you should do it because it's a natural monoamine oxidase inhibitor. And so other ones I would say cheese, alcohol, the ones those are the main ones, fava beans especially. But yeah, you'll definitely have to teach the doc about this.
yeah.
Like I say, doctors don't know much about nutrition. They're just not taught it. It's not their fault. They're just not taught it. Unless they dig into it, they're not going to know. Um, but yeah, it's a really kind of a rare thing.
Gailey, let me know if that helps a little bit. Thank you for asking that question for your son and being here with us tonight. Let's get to let's see. I know. Michelle. There we go. Michelle is asking: ivermectin kills parasites in the body. Is that correct?
It is an anti-parasite.
Yeah.
It also works in a lot of other ways too. That's why we use it, for other reasons. But it's been used for, decades for that. It's won the Nobel Prize.
Yeah.
We use it in little kids for lice, and scabies, and things like that.
All right. Thank you for that, Michelle. Let's get to Robert and Janet. What are your thoughts on blue burn tincture for weight loss?
Man, I don't know anything about it.
Robert and Janet, I'm going to write this down. Let's see. Blue burn tincture. We're going to do a little more
I don't
research
know.
on that.
Don't know. Wish I did. We'll look into it.
We'll look into that, Robert and Janet. Thank you so much. Let's see where I'm at. I'm going to put this up from Roel. This is a super fun comment. I've been consistent with my fish oil and my triglycerides come down. That's awesome.
It's amazing. It'll really lower your triglycerides. It'll cut them in half.
Yeah.
That's an amazing over-the-counter treatment for it.
Thank you, Roel, for that comment. Angela's asking, what benefit, if any, does Sermorelin peptide give? I love this question.
Yeah. I like Sermorelin. The one I take is Ipamorelin. I think it's a little more potent. But Sermorelin is what it does, really, it kind of stimulates your body, your brain to make its own growth hormone. And that's kind of what it works. Remember, growth hormone is a repair hormone. So a lot of people heal faster with it. People think of bodybuilders using it, but really you need it as you get older because especially if you've got a lot of debilities going on, it really is a healer. But the one thing about it, and again, you have to take the injectable form of it. But we tell people to take we recommend it to a lot of our patients. They seem to be a little less injury prone, and it kind of simulates the effects of growth hormone without the dangers of, or illegality of growth hormone. Um, so it does uh, promote healing, um, and also, it also promotes a little bit. You'll get a little bit leaner around your middle with Simorelin. If growth hormone is great for leaning people out, so it builds muscle but burns fat. It's not going to be as potent as growth hormone, but certainly it is one of those good adjunctive therapies you can do. Um, like I say, the injectable form's the one you need, and you do it. You do it at night on an empty stomach, about an hour before bedtime, 5 days a week. So I do like Simorelin. Some people call it Cimarelin. I call it Simorelin, but it's a good little peptide, very popular peptide.
And
And it doesn't have come along with the dangers of growth hormone. So, and again, if you do take this, remember, take it for 2 or 3 months. You're not going to feel anything before then. It doesn't work overnight. Give it time. I've had people take it for a month or sometimes even 2. I don't feel anything. Give it time.
And Angela, we didn't explain this with Robin Riddle on Sermorelin, as well as a few of the other peptides. So if you search for peptide Robin Riddle or Sermorelin Robin Riddle, that should show up on our YouTube channel. Let's see here. I think real quick, I see my sister's in here, our esthetician. I want to put this up for her. We've got a Mother's Day special coming up May 5th through 9th in our Johnson City clinic, and I believe we have some in our Knoxville clinic as well. So just mark this on your calendars, guys. Mother's Day, it's all week, May 5th through 9th. I'm going to be putting this up the next couple of weeks. So hope you guys get to take advantage of some of these amazing specials. Thank you, guys. Thank you, Kelly, for being in here as always. Okay, let's keep moving here. I see questions are coming through, and I want to make sure we get to as many as possible. Thank you, guys. I saw Lato had a question, and now I'm missing it. It's around DMSO. Let's see. There we go. Thank you, Lato. Looking for a range of how much DMSO ml per kg of 99.99 orally a healthy person can ingest. This might be stuff you're researching right now, Doc.
Yeah, I'm afraid to tell you, I'm still making a decision on how much cheese, but 99% pure is way too high. I mean, you're looking at, orally, you need to be down really lower, maybe 5% or so. Again, when I ordered some that was 99% DMSO, I diluted it half and half and then use it on joint. But, orally, hold off on taking any of that. And again, go look at the Midwestern. If you look at his blog, he gets pretty specific about it. So look at the Midwestern doctor's blog on DMSO before you do anything like that.
Lato, thank
again,
you so much.
I think it's pretty safe, but you really need to do your research and look at it before you ingest that high percentage. Some pharmacists even use as low as 2% DMSO.
Lato, thank you for that. I hope that helps a little bit. Real quick, I'm going to put this up for my girl Jasmine, our esthetician in Knoxville. She's running
Jasmine.
specials for Mother's Day week here in the Knoxville, the West office. Jasmine, thank you so much. Jazz is my SD bestie. Thank you for being in here as always, each and every week. We love you. All right, let's keep going. I want to get to as many as possible here. If I can find where I was. There we go. Motaz is in the building. Does the doctor have any recommendations for supplements to take for kidney health?
A good multivitamin that has D, C, E, the gamma E. The main thing with kidney health is that you drink enough water and you avoid a lot of non-steroidal anti-inflammatories and you keep your blood pressure good. And if you happen to be worried about that because you've gotten a CMP blood test and your glomerular filtration rate or your creatinine is a little bit high on your blood test, then get another one done with a cystatin C test on it, because that, and a guy like you that works out all the time, that has muscles, that GFR is not going to be right. That creatinine is not going to be right. It's not going to be accurate. So, and all my guys that work out are pretty muscular. I always draw a cystatin C along with the regular CMP. So those are the things I would do before I would, put you on any specific other supplements. I'm trying to think of anything else that I would suggest for that. And there's probably not, just the regular stuff that I've talked about, of mostly avoiding things that could hurt your kidneys, like a lot of prescription medicines.
Mm.
Um,
Motaz, thank you for being here, brother. Thank you for the question. Hope that helps a little bit. Let's get to Rachel. Rachel's asking, what would be considered a heart-healthy diet other than the obvious processed foods? What should be avoided? And I know you're not going to say cereal.
I thought the American Cardiology Association recommends cereal, don't they? Well, I'll tell
No,
you here.
heart-healthy cereal.
This is another thing I'll tell you. When you're asking, who's the last person to ask about a heart healthy diet? A cardiologist. Don't ask them, because they're going to put you on a low fat diet every time, which I don't believe in. I think it's more low carb, low sugar. It's really more about insulin resistance than it is about cholesterol. If you do your deep dive on it, we've been sold out on that cholesterol myth that it causes heart disease. In my opinion, it doesn't cause heart disease. So you can eat eggs. That's a heart healthy diet, is eggs. Paleo, Mediterranean, maybe carnivore, even though your total cholesterol may go up with that. It may, probably will. Don't worry about it. Look at all the other markers that we do for that. But certainly processed foods and sugar. Sugar is the worst, thing you can do. Try to keep out inflammatory foods. Make sure your gut's healthy. Your gut's healthy, your heart's going to be healthy, usually. So that's what I would say. I would go against, recommended American Heart Association diet. I just don't believe in it, personally.
Ashton has a great suggestion here: Cheerios for your heart health.
Yeah, they get paid how much money every year to put their American Heart Association sticker on there? In the millions.
Ashton, thank you for that.
They're
Thank you for
bought
being here.
out. I'm telling you, they're bought out. Okay.
All right, let's keep moving here. Thank you, guys. Real quick from Jack: can the vagal stimulator increase the risk of a syncopal dizzy spell?
I've never seen that. Personally, if I come in from riding my mountain bike, or just, really a 2-hour session of pickleball against really good players in the heat of the day, and I'm just worn out, the last thing I want to do is put that thing on there. So unless I do not do it, if I'm anywhere near not hydrated and, feeling pretty good. So I wonder where I was supposed to. I need to get that vagal stimulator down just to demonstrate this thing. So, I mean, I suppose I just never seen or heard of that happening. If you're one that faints a lot, I've had people faint from almost any situation you can imagine, being a doctor for 40 years. Of course, a lot of people faint when they get their blood drawn or they get a shot. And remember, as long as you know you're fainting, get to the ground, get your head down. You'll be fine. Or next time you get your blood drawn, lay down and let them draw it. You can't pass out when you're laying down.
Yeah.
It's rare as hen's teeth. But so make sure you're hydrated. It's all I will say with that. But I've never seen it cause I suppose if you had a lot of heart arrhythmias, AFib, or sustained SVT or something, I might be hesitant about doing it. But otherwise, I think it's really safe.
It's a weird feeling, in my opinion, like when you do it.
Yeah, I wish I could get her to bring that down. I'm gonna have to get it down.
Well,
That True Vega.
True Vega. We're gonna stay
She's
tuned
not
here,
listening. She's not listening.
guys. No. Let's get to
Bring me some meatballs too.
uh, excuse me. Kelly, what's going on? My sister's in the building. Does methylene blue
Okay.
help stomach issues?
I never use it for that, so I can't see where it would help it. To be honest with you,
I don't think
it can
yeah.
certainly help urinary tract infections.
Yeah.
That may be a good supplement for your kidneys. It'll turn your urine blue. Some people freak out over that. It just means it's working, but interesting.
No stomach issues there. It hasn't bothered my stomach, and I take it on an empty stomach actually.
Oh, I thought she meant, does it help stomach issues?
Yes. Yep. Yep. Does methylene blue help stomach issues?
Yeah. I don't think it would help stomach issues.
All right, let's get to Kay here. Another methylene blue question. Why can't you use methylene blue while taking Zoloft?
You can take it with that. If you know, methylene blue is an MAO inhibitor, and you know it. You know what? Hang on. You know where my True Vega machine is? It's under where I read the newspaper on the desk. It's my machine with the spray on it too. Why can't you use meth? You can. You can't. Some people say you can't because it may cause serotonin syndrome. In other words, you have too much serotonin. But I just, you'd have to use huge doses of it to get that. Knock on wood, I've never seen serotonin syndrome with anything. It's reported it's happened, but if you read the literature, it'll warn you about that. But I've just never seen it to be a problem. But like I say, I always start out slow.
Yeah.
But you're certainly going to see that warning: serotonin syndrome. Be cautious. So if you are on it, you might want to start out, use the drops. And thank you. You didn't bring the little spray bottle.
Hey, Doc, real quick, because we're getting a couple questions around methylene blue. Can you talk about dosing a little bit? Just kind of starting dose,
especially if you're on Zoloft or SSRI. You might want to start out at like 4 drops once a day. Take it in the morning. You go to 6, go to 8, go to 16. It's a really low dose. And again, remember, they put this in people's veins. You're taking it orally. It works better if you take it with vitamin C. So the pills called Neuroprotect one pill would be 16 milligrams. It'd take 32 drops to equal 16 milligrams. That's a half milligram per drop of the drops if you get the liquid form. So just be cautious. And again, if you feel a little hype, if you feel too hyper and everything, bring the dose down.
Yeah.
But knock on wood, I know it's on there, but I've just never seen it happen.
Thank you.
You don't want to be the first either, so be cautious.
Yeah. While you're doing that, Pop, I'm gonna put this up from Lisa because it kind of reminds me of what Andy was going through with the allergies are kind of nuts here in East Tennessee. Since having COVID the very first time, it's totally destroyed my sinuses. I have such a major severe sinus headache, nasal pain, and face pain. I'm taking amoxicillin and prednisone and fluticasone nasal spray. It hurts to drink or swallow or move my face. Is there anything else I can do or take to help ease this? Owen have bilateral ear infections as well. Sorry about this, Lisa.
You probably need a more potent antibiotic than amoxil.
Yeah.
I would get on a more potent one. Augmentin would be the one I would take. Works a lot better. Take your probiotic because they're all hard on your stomach. But the other thing I would do is, believe it or not, I would use Afrin nose spray. Yes. Squirt Afrin up your nose. It'll open everything up. It'll drain better. Do facial steam, get in a steam bath, maybe use, nasal irrigation with a Navage or something like that with salt water. It'll get better. I even had to give somebody a Toradol shot and some oral Toradol because their face hurt so bad. It's especially worse if you lean forward, all that pressure comes out.
Yeah.
And in some cases, I mean, if it's persistent, doesn't clear up, doesn't clear up, doesn't clear up, I'll get a film of an X-ray, and if it's really just blocked off, sometimes I have to go in there and drain it. I don't do that, but the ENT guys do. So change to Augmentin. The other stuff's good. Add some Afrin to open yourself up. And avoid taking antihistamines right now when you're in your situation. You can take a decongestant, but avoid antihistamines. They can make it worse. They dry it up too much and it won't drain. So that's why I like the Afrin. You're probably totally stuffed up and can't breathe out of your nose. But you're on prednisone. You're on some pretty heavy hitters, but Augmentin. Maybe sometimes I give a shot of Rocephin, a shot of an antibiotic. We get pretty aggressive with it. We don't want you to end up in the hospital with it.
Yeah. Lisa, thank you for that. And
vitamin C. Vitamin C is always good.
Yeah.
I like IV vitamin C. I used it a ton during COVID. And if I get sick, I'll take a vitamin C. I'll take a Myers cocktail.
Yeah. Real quick, let's get this from Mark here. Pope Francis, who passed away this week, was diagnosed with steroid-induced type 2 diabetes in February 2025. Some believe steroids worsened his conditions, triggering diabetes, weakening immunity, secondary infections. Do you think the very steroids meant to help him amplify the risk factors that ultimately contributed to Pope Francis's stroke, coma, and heart failure? What's your thoughts on this?
Maybe. Yeah. Sometimes you have to use it, just to make sure they can breathe. Steroids are, it's like Lisa said about the prednisone. I mean, if you have to use them high doses chronically, man, it causes problems. Prednisone is a lifesaver, and it's chronically, it can really induce a lot of problems like diabetes, adrenal Cushing's. I mean, look at his face. He had that moon face of somebody on steroids. He had, the buffalo hump in the back. So yeah, he certainly looked like the puffy bags of water retention. You could tell he was on steroids, but he had to be because he had basically one lung and recurrent pneumonia. I mean, he was very debilitated. And of course it can cause diabetes, which can cause heart failure, stroke. So yeah, it was just it was a host of things that probably contributed.
Yeah. Mark, thank you for that. And real quick, this is fun from Dave. I love you, Dave. First choice, Gibson or Fender?
Man, that is a toughie. Man, that is so tough, Dave.
Dave brought out the toughest question of the night.
I'd say Gibson.
Okay. Gibson
People
for the win.
it's just like Mustang, Camaro. I like Mustang, but it's just a personal choice. They're both great, and I've got both, of course. I know Dave's a great guitar player. I'm just a guitar novice and a collector, but
I love this.
That's a great question. What about you, Dave? What's your favorite?
Roel, the guitars will be back. The guitars will be back.
They're in the shop. I'm getting all of them restrung. They're in the cases right over there. I will show you one guitar I have, though. Hang on.
Let's see it. Then Lori, I see your question. We're going to get to Lori's here too. Gosh, thank you guys. These comments are so amazing. Thank y'all so much. Ooh. What's that?
The very first guitar I owned.
Is it?
I was 10 years old, yeah.
What type is that?
It's one you've never heard of called a Kingston. I bet Dave's never heard of that. I mean, it's just an inexpensive guitar, first acoustic. I was 10 years old when I got that. It's a shame I can't play any better when I got one back all the way at 10 years old. Here I'm 70. That's 60 years I could have been playing more guitar. I could have been better.
Dave's favorite is Fender.
I figure he's a Fender
that
man.
From Jack. I love it. Real quick, I want to make sure Kristen gets her question answered. What can cause a thinning optic nerve fiber? Then I also see one from Charlene. What's your thoughts on this for Kristen here?
Some kind of degenerative process. Sometimes you think MS. Hopefully That's always when you got a malfunctioning optic nerve, you got to rule MS out, multiple sclerosis. But I'm sure there can be other degenerative conditions that can cause it. Um, but I'm not enough of an expert to tell you what it may be. But make sure that you don't take that lightly, that you go in and,
Yeah.
get an MRI of your head and all that, and look and see. But that's the most common thing that comes to my mind.
Okay.
Doesn't mean you have MS, but certainly rule that out and, um, look and I'm sure your ophthalmologist is going to check your pressures and see if you have any, you know, all right, good, good. Hopefully you're not a diabetic. Diabetes can be a cause of that as well. It'd be interesting if it's bilateral or unilateral. Again, not being an ophthalmologist, I'm sure their differentials big,
Mm.
but if your ophthalmologist can't give you a clear etiology, but sometimes I'll think about vitamin deficiencies,
Mm.
toxicities. So you probably need to get a blood panel like something like the Cleveland panel. Look at all that inflammatory. Just one unilateral, yeah. Interesting. I don't know if you've ever had any damage to your eye, uh, trauma. So you can think about that, but detached retina, something's interfered with your blood supply. Um, you always, when you have a very small arteries, you always have to think, is it atherosclerosis? You should get a CT calcium, just make sure you don't have calcium buildup.
Yeah.
In your small arteries. Do you have any other arterial plaque or anything like that? So it warrants a workup for sure.
Yeah.
Let us know
Kristen,
what they
yeah.
find.
Yeah, Kristen, keep us posted. And thank you for being here tonight with us. And let's get to Charlene. What doses of ivermectin do you take twice a week? I know it kind of changes based on weight. Is there any sort of, in general, you can help with?
Yeah, I don't know if I said this. Say a 70-kilogram person, um, I'd take 30 milligram twice a week.
Okay.
If I was, I'd start out there for cancer. Now, again, if you're a young lady that weighs 130 pounds or so, if you're doing it for prophylaxis or travel, like for travel and all that, I just take 15 milligrams.
Mm.
We used to calculate it out when we did it with COVID to the kilogram, but I don't think a few milligrams is going to matter. It's a very safe medication. So, you could probably get by with 15 milligram unless you have something more serious going on.
Thank you for that, Charlene. And real quick for Lori, how do you feel about GABA?
I like it. Relaxes you. Some people think it helps them sleep. It's one of those things that you can use along with valerian root or ginseng. It's one of those adaptogens I think calms you down.
Mm. Thank you, Lori, for that. And real quick, Kristen's saying the blood panel was good. Could it be thyroid potentially with the optic nerve?
Always look at your thyroid.
Mm.
Always look at your adrenals, look at your thyroid, look at your insulin numbers to see if you have any kind of, that cortisol, insulin, thyroid triangle that affect each other. Always look at those. But yeah, if your thyroid numbers look pretty good, you don't have hypothyroidism or hyper, then it's probably not your thyroid.
Thank you, Kristen, for that. All right, Doc. I think we're
Truvega.
we're ready. Let's go, Truvega.
I'll say this on the way out.
So Truvega.
Yeah, Truvega. It turns on. You turn it. You spray your neck.
And what is it? Always right side?
No.
Okay.
You got your vagal nerve runs there and runs there. Then it sinks into your phone. See if I can find it. Be able to find it because my phone's been acting up today. There it is. So it's going to come on your phone. And that way you can get a readout. But you just turn it on and you put it right here, and you can feel it buzzing because it kind of pulls your right lip down. You turn the volume up on it. I turned it up to 8, 9, 10. You can feel it tugging on your ear, and you just hold it there for 2 minutes. It'll go off automatically. This kind of calms you down. It
That's
activates that
interesting.
parasympathetic nervous system. Pretty
So,
cool.
so you keep it on for 2 minutes?
Yeah, it automatically goes off. It's a 2
Okay.
minute little treatment.
Super cool. One, I got a huge shout out to Shelby in our Bristol
True
office. Thank you,
Vega.
Shelby, for being here. Look at that, True Vega.
Yeah.
And I'm going to put this up because this means a lot to us. Mark, a 10 out of 10. Thank you, man.
Man, Mark, thank
so
you.
much. Thank you.
That's a lot coming from Mark.
Yes, Mark, thank you so much. Guys, how'd we do? Shelby, I love you. Guys, y'all are the best. Roel gave us a 10. Thank you, guys. A lot of Fender fans in here. And then a Sears guitar.
Hey, yeah, I've got my Sears guitar. Where is it? Well, my Sears. It's called a Silver Tone. I've got one. I've got a 1964 Silver Tone, which was purchased from Sears with the amp in the case. It's really a cool little. I don't know where it is. I had, but it's a cool little guitar. I'm telling you, a lot of your rock stars back in the early 60s started with it. That's the guitar they started with. But hang on, I'll show it because it may fall out. But,
this is the Sears one?
Yeah, this is a Silver Tone.
Oh yeah.
I don't know if Dave ever has seen that. This is a 1964. But the cool thing about it is not that Jimmy Page started out on it, and he had a little what we call skiffle band. But this is the guitar case, and the amp is built into it. Have you ever seen one of those?
That's cool.
I bet Dave's never seen that. Dave's
That
not
is
as old as
awesome.
I am either. He's not as old, but yeah, it's pretty cool.
I love it. I love it. Thank you, Shield Nutraceuticals, my brother Steve. Thank you for that. Real quick, I got to put this up from Carter. The beard is bearding. Yes, I've got to trim this thing. I love it. Let's see. Tom, I love you, Tom. Thank you guys. Thank you, Sandy. Thank you so much. We got to make sure that you get to see Tom in the Kingsport office here shortly. Thank you, Tom.
Oh, good.
I love this from Lotto. A lot of great comments tonight. Left venous nerve stimulation may act like a pacemaker. Interesting. The right venous nerve. Interesting. Thank you so much for that. That's cool. That's super cool.
We learn as much as you do on this thing.
Guys, I want to thank y'all so much for being here. Michelle, I see you from Oak Ridge. Thank you so much. It's so good to see you each week.
Oak Ridge, our old stomping grounds.
I'm going to put this up from Ashton. Thank you, Ashton. Tell God I made it up out the floor without using my hands, but had to uncross my legs. There you go. Wow. I have to have my legs crossed in order to get up without using my hands. But that's pretty good.
Awesome. That's awesome. Speaking of Oak Ridge, that's where Andy, my youngest son, was born. Yep. Maybe that's why he's so smart. Don't you think?
Oak
Ridge is full of smart people.
Yeah, Michelle's in Oak Ridge.
All those smart people, on the block, that we live. It's all these nuclear physicists and all that.
Jasmine, I love you. I hope it's the best week ever.
You too, Jasmine.
Yes, the beard fits. Yeah, I'm with you, Mark.
You ever see that movie Deliverance? Maybe it fits in there.
Guys, we love you. Thank you so much for being here. So many of you on our team were here tonight. Thank you guys for being here after a long day at the office. We love you so much. We're going to call it an evening. We'll be back next week answering your health and wellness questions 7 to 8. Don't forget Mother's Day specials happening May 5th through the 9th all week long. Take advantage of those in each of our offices. And we're going to call it a night. Let's see where Brad is at. There we go. Thank you, team. Brad is going to take it away. Pop, I love you, man.
Love you, man. Good night.
I'll see you in a bit.
Don't go away.